foot's on the brake, the car moves next to you, and for a split second, you think you're moving. That's a very brief example of what it means to be visually dependent. But imagine living like that. So you're in a mall, and the crowds are going by you. If you orient to the visual world, you're destabilized every time a person walks by you. Does that make sense? Okay. So now we're going to look at the motor, and we're going to look at automatic and adaptive. All right. So what's going to happen is she's in the same position, backwards until I tell her, and then she fixed it. Did you see that? Did anybody see that? Watch again. I'm putting a motor stimulus, a stretch, into the system. What should happen? You should get a quick response, right? And this is a sub-threshold stimulus, so it shouldn't be hard at all.
So is she using technically a hip strategy?
Technically, what she's using is, as we're going forward, it's stretching the gastrocs, and so she actually has to generate a posterior muscle response in order to bring herself back up to upright. So I'm destabilizing her surface. She has to be able to bring herself back to upright. Okay, watch this. So that was a small one, but this is a bigger one. So if I put in a bigger stimulus, what should the motor response look like? Bigger. And bigger and faster. If the central nervous system is intact. Meaning the stimulus is going up and generating motor output right away. And so you can, what this is timing in milliseconds, and her response was about 80 milliseconds. Yeah. Okay, now watch this.
So this one's not reflex anymore, right?
This is actually, it's actually automatic. If I put an EMG on her gastroc and soleus and I actually measure the stretch and the response time from the muscle, that would be reflex. And I can do that. That's what that is. So if I want to know the integrity of her stretch reflex, I can measure that. And then I go the other direction. Who should have trouble with this test? Only someone with a brain problem. Okay? So, if I have someone with multiple sclerosis, I want to know, is this still intact? If it's intact, what's my prognosis for their functional balance? Better. If they're a patient with MS and this is impaired, what's my prognosis for their balance control?
Compensate.
We're going to have to teach them to compensate because their innate postural response system is not effective. Does that make sense to you? Is there any way clinically we can duplicate this?
About like a rug?
Yeah, it's a little hard. To Mallory's point, it's a little bit difficult. Okay. Okay. So that's the motor control test. And no, I'm not going to test you on this, but I am going to test you on the concept of the fact that you want to know something about automatic motor. Right? What in the mini best gives us the automatic motor piece? The nudges. You what? Yeah, exactly. So now let's go on to adaptive motor. And we're almost done, guys, don't worry. Okay, watch this. I didn't tell her on purpose. Why? Correct. Now watch again. It automatically does it. I'm not running it. okay? So it does it the same 5 times in a row. If that's the case, what should happen every single
Should get
time?
better.
Better, 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 when she has an intact central nervous system. How many chances in life do we have to recover from that pothole we hit? Correct, which is why I didn't tell her. Because there's a way to do it so you don't upset your patient, really. There is. I've got it down, really. So look, she's getting better and better and better for the most part. But now she's kind of figured it out, and so it's kind of, you know, she's got it. But a lot of times people will fall that first one. And then the next one they'll get a little better, or maybe a little better. What if she doesn't get better at all every time she falls? How do I feel about that prognostically? I'm not sure, because I don't know where that's coming from. Is there something wrong in the brain that's preventing that adaptation? Is it fear is so overwhelming that the patient can't handle it? But is that something I clearly need to work on? Because every time they hit a pothole, they're going to fall. What's their fall risk in the community? High, high, high. So is that a high priority piece of my program? And how can I mimic this? How can I train this? I could use a wobble board and start predictably in a closed environment, right? I could make it unforeseen was the only word that was coming to my mind. Wasn't predictable. Yeah, not predictable to the patient. Thank you. Thank you for Mr. Wordsmith over here. The other thing I'm going to say is I can actually, are your feet okay? Can you stay up there? Because I'm going to show treatment. So go ahead and hook yourself up if you want, because I'm going to make it rocky and rolly. So I'm going to go to training now, because I want to exemplify what I was talking about in terms of, do you remember that I said that there was an optimal program? That patients with balance problems often have lots of impairments, right? So if you said, I'm going to work on strength, I'm going to work on walking, I'm going to work on vestibular, I'm going to work, if you did that, take forever. So a really good program does 2 things. 1, we're going to deal with the sensory in, motor out loop all at once. So we're going to do sensory activities with motor activities. Okay? So, in this case, I have exquisite control. Now, we already know that Erica doesn't like forward, right? So let's pick a target configuration that challenges her in the forward direction. How about that? Center 3 anterior targets. All right? And so I'm going to pick center 3. And it is currently set at 50% of her limits of stability. Do you think that's going to be too easy or too hard for her? Too easy. But is 100 too hard for her? Maybe 80. Let's try 80. I'm with you on there. This is, it's not a perfect science, but you start intuitively, okay? And so we're going to make those targets, watch this, 80% of her available limits. So that's the task, is an anterior weight shift. Now, from an individual point of view, what other impairments did we say we want to work on? She didn't like kind of the moving thing at first. Let's just pick that. Okay, so that's the environment, right? But I'm going to also make the task have that automatic or adaptive postural control piece in there. And so I am going to have the floor move predictably in direction, but not in amount. So it'd be something like a sudden pitch on the tilt board that she didn't know was coming. So I'm going to make it variable. And I can also make this move, when it tests at 100% difficulty. So when I treat sensory impairment, guess what I can do? Make it 20% difficult. So let's kind of take a look at what that means. So I'm going to set it variable, and I'm going to set it at 60% difficulty, okay? Just so you can kind of get a sense. So I'm going to work her vestibular system at 60% difficulty. How easy is this to document? All right, so 60% of her sway, 60% of her sway. Watch what happens. Erica, your job is to get in the middle, okay? And when I started, I want you to shift your weight toward the target that is yellow, okay? Go. Now, notice what's happening. Okay, back to the center. Go forward, forward, hold, get out there, get out there. Ooh, 80 might be a little bit, well, come on back. It's just outside of her reach. Over to the right. So can you see how much that's moving?
Yeah.
It's about 60% of her movement. Okay, so let's see what that looks like if I make it less. And I want less of an error. I'm going to put it down to 20%. Can you even see this? That's how small I can make the challenge. I'm actually challenging her adaptation. I've got the floor moving unpredictably. I'm challenging her sensory. I'm challenging her motor in a task.
You can't detect if the heels are off, right?
You don't want the heels off, right?
The computer can't detect it.
No, you're watching,
Yeah.
you're managing. Okay, so that was 20%. Now let's, hold on. Okay, we're gonna go to 100%. Ready? Okay, how's she doing? She making some errors?
Or here.
And she overshoots a little. Okay. So she's making some error, but I would almost say won't be long before I push her forward. So I actually have the ability to exceed her capabilities, just like that test. Okay? Watch this. Okay, hang on. I'm going to make it 160% of her sway, which means it's going to, the surface and the walls are going to move more than she does. Ready? Ready, ready. Okay, now we're making some errors, right? So I can hyper train as well. Okay, do I get my geriatric individuals to 160%? Occasionally, but very rarely, maybe one. Do I get my geriatric individuals to 100%?
Yeah. Sure.
Yes, that's my goal. Absolutely I do. Okay. So I won't put it on random, but I can actually make it do whatever it wants. And that is real life, right? So I actually work very hard to get to random settings as I get someone close to community reentry. Just thinking with what has to still be done here. Questions? I don't want you to lose sight of the overarching concept that we're really talking about breaking down balance into its parts.
I